Hello, my name is Barbara Troupin, and I'm the co-chair of Young Women in Bio in the San Francisco Bay Area. As part of our Young Women in Bio online series, this module will be about safe hygiene practices in the era of COVID-19. Specifically, we will discuss what is important to know, the science behind why these practices are important, and how best to follow these practices to keep yourself, your family, and your community safe and healthy. Let's get started. Everything you will learn today is based on the recommendations from the Centers for Disease Control and the World Health Organization. As the situation evolves, some information may change or be updated. I encourage you to look at the websites here for credible, up-to-date information. As you may recall from previous Young Women in Bio online modules, we know the virus spreads person to person through respiratory droplets. These are the little wet drops that you expel when you cough or sneeze. If you are infected, these droplets can carry virus particles, which can get others sick. A cough or a sneeze propels these droplets like they're shot out of a cannon into the air for many feet, putting all the people around you at risk and settling on surfaces nearby. We're going to discuss the most important practices to keep you and others safe. Covering your cough. So what does this mean for you? It means you want to cough or sneeze into the inside of your elbow. Why? This traps the droplets from being spread through the air and protects others. And it also keeps those droplets off your hands, meaning the viruses can't be left on surfaces for others to come in contact with. Alternatively, you can cough or sneeze into a tissue, which also effectively traps the droplets. The tissue then needs to go into a lined waste container. In any case, you should remember to wash or sanitize your hands afterwards. And we're going to talk about that in a moment. But first, a question for you. So let's review the most important scientific point so far. How exactly does the COVID-19 virus spread from person to person? I'll give you a moment. As we've heard in a few of the modules, the answer is through respiratory droplets that are expelled when you cough or sneeze. It's the basis of our understanding of how the coronavirus spreads from person to person, and a good thing to remember as we move on through this module. Our first hygiene practice was about sneezing safely. Now we move to the second one. It seems simple, but it's truly one of the most effective things we can do to protect ourselves and those around us. When you do it frequently and well, you make a great contribution to the health and the safety of yourself, your family, and your community. It's simple. Hand washing works to decrease transmission between individuals, and there's great data to prove this. If you have virus particles on your hands and you do not wash them off, they can get transferred to surfaces that other people touch. This is another major way the disease can be transmitted. Hand washing removes germs and viruses from your hands so they can't be left for others. Another danger is that viruses from something you may have touched can get transferred from your hands into your body. This is why you've heard the guidance to not touch your face with unwashed hands. If you have virus on your hands and you touch your nose or mouth, you can introduce the virus into your body. So very important. Avoid touching your face with unwashed, unsanitized hands. Let's talk more about hand washing and the best technique. Here's the medically approved technique for washing your hands to remove germs and viruses. Start by getting your hands wet. Do this under running water. Water can be of any temperature. Use enough soap that it can be easily spread to all surfaces on your hands. That means front and back, between your fingers, and up to your wrist. You can use bar soap or liquid soap, antibacterial soap, or regular. Just soap and enough to do the job. Soap is a surfactant, a type of chemical that helps to lift the germs from the skin, making them easier to wash away. Now comes the dance. 20 seconds or more is the goal. That is the equivalent of singing the happy birthday song twice, or the full ABC song, or find a song that works for you. A cool website is washyourlyrics.com. It allows you to pick any artist and song, and it will tell you how far you need to sing to know that you've gone past 20 seconds of scrubbing. Importantly, this does not mean 20 seconds in the bathroom, not 20 seconds from turning the water on, but it's 20 seconds of scrubbing and lathering. The whole process from start to finish is more like 40 to 45 seconds. It's about the lather and making sure you cover all the surfaces. Take a look at the pictures. Did you get both sides of your hands, up to the wrist, around the fingers and thumb, between the fingers, in the webs or the skin between your fingers, including between your thumb and index finger? You want to interlace your fingers to move soap around. This means clasping your hands together with alternating fingers. Don't forget under your nails. You can do this by curling your fingers across your palms to get soap underneath your nails. Once you've passed 20 seconds of scrubbing, it's time to rinse. You want to rinse well, since leaving soap on your hands can cause drying or irritation. You want to use clean, running water to rinse. Then dry your hands with a clean towel or an air dryer. So we've just learned that hand washing is the gold standard, meaning it's the most effective method to reduce germs. But sometimes we don't have access to a sink with running water and soap, so hand sanitizers can be a good substitute. Still, once you're home and able to wash, you do still want to follow the procedures for hand washing that we just talked about. You need to use a hand sanitizer with at least 60% alcohol content to be effective. Take a look at the active ingredients labeling, which I've shown here, to see the alcohol percentage. You want to apply enough hand sanitizer to make all of the surface of your hands wet. Go through the same procedures. Cover the fronts and the backs of your hands up to the wrist, between and around your fingers, and the webbings in between your fingers. Rub until all the alcohol has dried. Do not wipe off the excess or dry your hands. The biggest areas where people fall short on hand sanitizer is by not using enough or wiping off too soon. Hand sanitizer stays on, getting rubbed across hands until it evaporates or dries. Before we move on, I wanted to pause and ask a question. Which is the most important practice we can follow in this effort to decrease the spread of COVID-19? How did you do? The answer is hand washing, hands down. Remember to follow the approved technique we just reviewed. And hand sanitizers, when used appropriately, are a good backup when soap and water are not available. Remember to look at the labeling for the alcohol percentage. So what about face masks? Here's another one where the answer might not always be clear. Let's review what the recommendations are about the use of face masks. They have changed again recently, so this may be different from what you first heard. If you are sick, you want to wear a face mask to prevent transmission to others. If you are caring for someone who is sick, then wearing a face mask can prevent transmission from that person to you. The newest recommendation is that all individuals leaving their homes, even to perform essential duties like grocery shopping or exercise, should wear a cloth face mask. This is so that if someone has the virus but does not yet feel ill or know they're sick, they can protect others by not spreading the virus. These masks should cover your nose and mouth and fit snugly over your cheeks. However, it's still really important to continue following the recommendations to practice social distancing even if you have a mask on. The reason the CDC is recommending the use of cloth face coverings is to help decrease the spread without using the medical grade masks required by frontline healthcare personnel. Personal protective gear like face masks are in short supply, and individuals at high risk of being exposed to the virus, like healthcare and public safety workers, critically need those supplies. By not using them when they're not required, you free supplies to support keeping them safe. As we've touched on earlier, since respiratory droplets can carry the virus, we have to think about where they may have landed. We know from a study in the New England Journal of Medicine that at least some virus can survive on surfaces for many days. On plastic, there was virus RNA detectable out to 3 days, and on hard surfaces like stainless steel, virus can be detected for up to 48 hours. What does this tell us? It tells us to be careful what we touch to limit what can be spread from person to person or to ourselves. It's important to clean high-touch surfaces every day. This means use household disinfectants and cleaners or disinfecting wipes to wipe down these areas. Think about the places where you might cough or sneeze, or areas that are touched often, or places where things get put down frequently. Things like countertops, doorknobs, keyboards, remotes, or cell phones. For the electronics, though, you want to check manufacturer websites to make sure the cleaners you are using won't harm your devices. If someone at home is sick and they're able, they should be wiping down the surfaces in their isolation room and bathroom often. Be careful not to share items with people who are sick. You would want to disinfect those items even more frequently. So here's a chance to check in with one last pop quiz. Do you need to wear a medical grade face mask around the house? Did you get this answer? This one was a little complicated. Medical grade face masks should be for healthcare providers and first responders. Supplies are limited and they are at the greatest risk. If you are sick, you should stay at home in isolation in most cases. Wear a face mask if you have to go out, like to the doctor, and wear a cloth face mask if you can when interacting with your household members who aren't sick to prevent them from getting sick. If you are taking care of a sick person, you should wear a cloth mask to reduce the risk that you also would get sick. And remember, the recommendation is now, when leaving the house, whether you're sick or not, you should wear a cloth face covering to protect others. We've covered several important points in this presentation. Here are the main practices that will keep you safe and protect the community. Cover your coughs and sneezes. Remember those respiratory droplets. Wash hands frequently with soap and water. Second best is hand sanitizer. And remember, no touching your face with unwashed hands. Save medical grade face masks for healthcare providers and first responders who need them to stay safe while caring for sick patients. Wear a cloth face mask when you go out, whether or not you're sick. And wear a face mask if you are sick or caring for someone who is sick at home to prevent transmissions in the family. And you want to remember to clean and disinfect surfaces daily. All of the recommendations covered in this presentation are from trusted sources such as the Centers for Disease Control and the World Health Organization, and were current as of April 10th, 2020. Great job! Thank you for your attention, and thanks for helping to keep yourself, your family, and your community safe. Thank you for your interest in and attention to this YWIB online virtual event. Please check out our website for more information about virtual events and resources. Be safe and be well.